Thank you, Mary Lee, for that incredible introduction. She makes me sound a whole lot more accomplished. It's the accomplishments of that college are because of a lot of really terrific people that I work with. But thank you so much for saying all that. And when Mary Lee invited me to give this talk to you, first of all, I was just really honored. I'm honored to be here for a lot of reasons. In particular, because it is Kingsport and we have roots here. My husband grew up here and was born in Johnson City, and we've been part of the East Tennessee community for as long as I've been with him. So I feel really honored to be talking with this group, particularly today. But also, when she described a little bit about the Kingsport Kiwanis Mission, as she described more and more what it is you do, I said, of course I'm the perfect person to come and talk with this group because we have the same mission. And I want to talk a little bit about that and then get into a little bit of why and maybe what else we can do, what we can sort of double down on. So we do have similar goals: improving the quality of life through health, education, and youth development. From Mary Lee's description, that's what you do. That's also what we do. Let me elaborate. So your vision, improving the world one child and one community at a time. Mary Lee described these three pillars: health, which includes nutrition and exercise, physical fitness; ready to read, ready to learn. Mary Lee mentioned that my area of scholarship and expertise is in early literacy, and I'm going to talk a little bit more about that. And then youth leadership, service development, another part of what we do big in our college. And these three factors I'm going to talk a little bit more about, because remember, the title of this talk is about key ingredients, basically to get youth out of poverty, for social and economic mobility. I'll elaborate how that happens. So thank you for this work that you do. And here's what we do in my college. Education. So Mary Lee mentioned all the education departments in my college. We produce teachers, principals, superintendents, school counselors, educators who work in nonprofit organizations, and underlying all of that is reading. Reading is key, and I know you know that because this is part of your mission. If young children don't learn to read, basically by the time they're in third grade, the statistics for those young people are dire. And it's also not just enough to learn to read. They have to actually get proficient, because there is a basic level that a lot of kids will reach, but they have to get to the point where they're reading to learn, not just learning to read, but able to read texts so they can learn from them. And I know that that's a big part of your mission. Also in the college is health. Mary Lee mentioned we have the Department of Nutrition, we have the Department of Public Health, we have programs in exercise physiology, and in particular, we have faculty members who study family exercise. I'm going to elaborate on that on my last slide. And then also family relationships. We have a number of people in the Department of Child and Family Studies who study what it takes for healthy families to exist. So when we talk about health, it's not just physical health. It's physical health with family stability, emotional health, and that sort of thing. Okay. And then we too do youth development. It's probably a little bit different than what you're doing, but we have youth leadership programs. We work directly with high schoolers to help them develop their leadership skills and with a pathway to getting into college. Not necessarily UT, although that's what we really want, but any college if that's what they want to do. And then other youth development programs that are more focused on developing young people, we have a number of recreation programs. we prepare professionals in recreation. We also run a number of camps. Our signature camp is Camp Kiwanis, which serves young people with disabilities. And I love this camp so much when I go to visit because you can see the development of these young people with disabilities and also the development of the college students who are working with these young people. They are learning to work with people who are different from them. And working with people who are different from you is one of the life skills that help people move out of poverty and into the middle class. Okay, there's my nutrition picture, sorry. All right, so these are what I call the ingredients for social and economic mobility. So to have quality of life, these are the ingredients, and then this is just a little picture of a recipe. So I call this sort of a recipe in a sense. The ingredients for, again, helping youth move out of poverty into another social class, middle class life. It takes these. And you can look up here and see your work, the work of the Kiwanis Club here in Kingsport. So family stability, health access and promotion, I'm going to talk a little more about that, early childhood education, better schooling quality, and then / tutoring. And what we mean by that is communities that invest in their schools in one way or another produce people who have more opportunity to move out of poverty. Part of that is tutoring that comes with it. And what we've learned is that when you look across the United States, our schools, I'm sad to say this because this is my field, they sometimes fail kids. And they fail kids of all socioeconomic classes. But wealthy families, middle class families, what do? They go get a tutor, right? They can afford to figure, or they're savvy enough to move their kids out of one school and into another school. But we know that a lot of kids born in poverty either don't have that savvy or can't afford the tutor. But communities who invest in kids and help them get that kind of tutoring that they need are communities that produce youth that can move out of poverty. Okay, I'm going to show you what I mean by that in just a second. And then the rest of that list: college and career readiness, workforce development for both youth and the adults in the community, and then greater social capital. And what we mean by that is learning those soft skills that help people be successful in life. Learning the soft skills of interacting with others. And I will say this happens mostly when people are in organizations with people they're not used to being in organizations with. When demographic groups are mixed by income, by race, by rural, urban, by cultural background, when people learn to work with other people who are different from them, they gain social capital. Okay, so this is, this whole recipe, I didn't just make this up. This comes from this opportunity project. It comes from this man, he's a Harvard professor named Raj Chetty. And what the Chetty studies have done, he and his researchers have done, is they used a lot of data, tax records, census data, and they found 20 million children born in the 1980s. They were able to identify 20 million children who were born into poverty in the 1980s, and they found them at age 35 and then marked what was their income. Okay, you can only do this kind of study with big numbers like this. So 20 million kids born in poverty, they followed them to find out what are they doing at age 35 and what is their income. Those, out of the 20 million, those that had an income that was comfortably middle class or higher, they started to map back the communities that they grew up in. And they found what was it in these communities that enabled these young people to get out of poverty. And this is what they find. Okay, they found that in these communities, there were specific programs around health access and promotion. So nutrition programs, healthy eating programs, but in general they call them health access and promotion. They all had early childhood education. That won't surprise you, right? They all had community investment in the schools, and in particular, they had tutoring for those who needed it. They all had some sort of college and career readiness programs. And I'm not exactly sure what that specifically looked at. These two links here on the site if you dig deep enough, you would find that. They had workforce development for families, not just the youth, but for the parents as well. And then opportunities for social capital. And that could be as simple as they would have the soccer league would include everybody in the community. So they didn't just have the east side of the town soccer league and the west side of the town soccer league, because when that kind of thing happens, often people are just the kids on their street, right? But when they have the soccer league that includes everybody in the community, you have this mix which enables kids who are growing up in poverty to learn from their middle class peers. It helps white kids learn to interact with kids of color and so on. There was some disturbing findings from this big study of 20 million kids, and it's what they called the fading American dream. And what the fading American dream is, let's see, for people who were born around 1948, okay, some of you in this room or might be somewhere in that group, for those people who were born in 1948, back then, you had basically a 90% chance of doing better than your parents, even adjusted for inflation. That your income and your place in the world and economic and social status was better. But for people born in the 1980s, it's basically about a 50-50 chance whether or not those young people will do better than their parents. And there's, of course, a lot of reasons for that, but there's less and less of an opportunity for this social and economic growth. So, but back again to this work, if we look back at the ingredients, there they are, those are the ingredients. Those were the ingredients in the neighborhoods of the people who made it out of poverty. And that was a pattern across these 20 million people. And so, why is this really important? It's important to know what communities like Kingsport and the Kiwanis Club should invest in. It's really good for us to know that in the College of Education, Health, and Human Sciences, where do we put our time and energy and investments? And then also, I like to say, how can we even do what we do even better? How do we do more of it and better? So, of course, I'm going to say, what you do here, don't stop doing it. You are affecting people's lives. You might not see it in any given moment, but you are affecting people's lives in a positive way. If you're focusing on health, nutrition, exercise, reading, youth development, youth leadership. But there's also some ways to kind of double down on what we do as well. So let me share that. So always be asking, what is it that we do? How can we do it better? What's the research on what the most effective practices around health, the most effective practices around reading? So on attention to nutrition. So just Wednesday, as recently as Wednesday, there was a major conference at the White House called conference on something like food, on hunger, nutrition, and I can't remember the title, food accessibility or something like that. And I'm proud to say that 2 members of my Department of Nutrition helped plan this conference. And there's a beautiful report that's just come out about the findings from this. And of course, what we know is that food insecurity, that's a concept that basically means families or children they're insecure if they don't know where their next meal is coming from, is really related, obviously, to nutrition. And why is that? Because healthy foods are more expensive than inexpensive junk food. It's just easier to buy potato chips or a donut than it is to buy fruit. Easier, and it's more accessible, both financially and just around. And one of the big findings in this conference, there's a really nice report that's come out about it, is that when communities invest in simple things like transportation to the farmer's market, or even in urban areas, transportation to a grocery store, so they're not buying their dinner from a convenience store, for example. Those little things like that can be the difference in whether or not somebody's going to live a more healthy, nutritious life. Also, I have emphasized there family nutrition. We also find that as many efforts as we make to get healthy meals in schools, all of that's good. We should not stop doing that. Teaching young people about nutritious behaviors, that's all great. But it's much more effective if we do it for the whole family. And you know that. If they go home and they're still eating potato chips for dinner, then all the work that we've done during the day in schools is not going to be as effective. It's not wasted, but it's not as effective. Okay, so I encourage you to check that out. Let's see, here it is. I wrote it down. Food access and affordability. No, that's not what it's called. Here it is. White House Conference on Hunger, Nutrition, and Health. This just came out Wednesday. I had already sent my PowerPoint to Mary Lee, so I would have had it up here had I had a peek at this earlier. Finally, when communities support schools in getting better. And there's lots of ways communities can support schools. You put in a new playground that's designed to get kids exercising, right? Like there's all kinds of playgrounds, and some of them require more exercise to play on them than others. So investing in a school playground is a simple way to really help a school. If you want to help a high school, you find out from the school, what's the teacher you really need that's going to help kids, again, have more opportunity. For some people, it might be a physics teacher. Help the school figure out how to get a physics teacher, which we don't have enough of. For others, it might be something very different. The old shop teacher, like let's teach some very handy skills for people in high school. So looking into the high schools and looking into the elementary schools and asking what they need and investing them makes a big difference. And then finally, I said I'd talk a little bit more about reading. This is my last slide. So attending to programs that work. What we've learned about tutoring is a lot, because a lot of people are doing tutoring now, especially since the pandemic, with all that learning loss that has happened. A lot of people are investing in tutoring. What we've learned about tutoring is that it should be very intentional about the children we're tutoring. If the children already know how to read, but just don't read, that's a big majority of kids, because they're on their phones or they're doing whatever else, then a program that just entices kids to read books is maybe all you need. A really fun book introduction, where even if you have to bring out some of those banned books, just to get kids reading and reading a lot. The second part of this is if they are struggling to read and we'll all know kids who've been through this, some even labeled dyslexic. If they're struggling to read and all we're trying to do is entice them with really interesting books, it could actually make it worse. Because kids who can't read, they're, number one, probably hiding it. They feel bad already. They look at that beautiful book and know, that's not for me, it's not accessible. So for those kids, we need a very different kind of program. We need a very scientifically based program that teaches them how to read, how to decode, the really hard part of reading. And there are scientifically based programs all around. So what I would emphasize for a group like you, if you are investing in tutoring, to really think hard, who are we serving and what kind of tutoring program would be best for these particular children that we're serving. And then finally, attending to youth development that leads to pathways of opportunity. The kinds of youth development programs that help children, young people, understand that there's something beyond high school for them, whatever it might be. Whether it's college or career or working with their family member in some organization or company or something like that. If they see the pathway, they're a lot more likely to get on the right path. They have to see it. And I know that's the kind of work that you do. Okay, that's my sharing about the key ingredients for social and economic mobility of youth. And thank you for the work you're doing, because you're already doing it. And at this time, I'll just take any questions you have. And it doesn't have to be about this. It could also be about anything related to UT. And of course, I'd have Randy answer that if he did.
Sure.
Yeah.
Put me on the